Everybody, and welcome back. It's now my pleasure to introduce our final panel of the conference, A View from the Marketplace. With us today, we have Jessica Walker, President and CEO of the Manhattan Chamber of Commerce, which represents and supports businesses across the borough of Manhattan. Prior to leading the chamber, Jessica was Vice President for Government Affairs at the Partnership for New York City, where she served as the chief liaison between elected officials and the city's business leaders. Also with us is Jennifer Jones Austin, CEO and Executive Director of Fpwa, an anti-poverty policy and advocacy nonprofit with 170 member organizations. Its work is centered on economic opportunity and upward mobility. Prior to joining Fpwa, she served as Senior Vice President of the United Way of New York City and Family Services Coordinator for Mayor Bloomberg. She's also a radio host, author, and chair of the New York City Board of Correction. Next, we have Wendy Darwell, President and CEO of the Suburban Hospital Alliance of New York State. In January of this year, Wendy became President and CEO of the Suburban Hospital Alliance and its two regional entities, the Nassau-Suffolk Hospital Council and Northern Metropolitan Hospital Association. And she previously served as the association's COO for 13 years, but what more difficult time to become a CEO of a hospital association than in the midst of a global pandemic. Prior to joining the Alliance, she served on the staff of the late U.S. Representative Maurice Hinchey, including in several legislative and communications positions, as well as chief of staff for 7 years. And finally, we have Ed Farrell. Ed is executive director of the Retired Public Employees Association. He joined RPEA in 2014 and is the longest serving executive director. His prior association management experience included the American Institute of Architects and the Conference of Mayors. He also worked in both local government and the state legislature, where he was deputy budget director for the Assembly Ways and Means Committee. And as we've said throughout this conference, more detailed information on our panelists is available by clicking on the speaker icon. So welcome to all of our panelists. Before we kick off, I did want to remind attendees one last time that if you wish to submit a question, to enter it into the Q&A section that you'll find on the bottom of your screen. And we will try to get to as many attendee questions as possible during the course of the next hour. So with that, we've covered an awful lot of ground over the course of the last 3 days. But as I've said before, this is really my favorite panel of the conference because it gives us an opportunity to hear from local stakeholders, to get their perspectives on issues related to healthcare costs, the challenges in the delivery system, and really an opportunity for us as health plans to hear from some of the key audiences and stakeholders that we work with. So I'd be remiss if I didn't start with really the biggest issue that we've all been dealing with over the last 2 years, which is COVID-19. We're now almost 2 years into this pandemic. The virus has threatened the health of New Yorkers. It's ravaged the economy. It's had a disproportionate impact on Black and Latinx individuals. It's created significant economic challenges for businesses across the state. And I think for our panel, each of you, it's probably affected you in multiple different ways. I think I'd love to hear from each of you to talk maybe about the challenges that the crisis has created for the constituencies you've served, and maybe a little bit about the ways that your organizations have taken to support and assist those constituents. And Jennifer, I'll start with you on that one.
Oh, I just first want to thank you for having me and commend you on a great conference, and just how proud and excited I am to be in this discussion with this esteemed group. FPWA is a social policy advocacy and organization with 170 human service member agencies. These member agencies are on the ground, working with individuals and families who in the main have low income and may present with other challenges, other sometimes related challenges and sometimes other distinct challenges. COVID, as we all know, created the greatest devastation in terms of community for individuals and families who are of color and who are low income. And what we continue to see today is that these are the individuals, these are the families, these are the communities that continue to struggle the most. The economic recovery is beginning, but it is slow to churn for people on the lower income side. What a lot of people found is that they knew that they didn't have enough income to make ends meet to begin with. COVID proved that all the more because they did not have funds, rainy day savings, if you will. And now there are issues about whether or not the jobs that they were in are provide them the protections that they need, the healthcare protections, as well as whether or not they provide them the incomes that they need to be sufficient and sustainable. And so these are some of the challenges that continue to present. And of course, it has a significant impact on their health and well-being.
Ed, what about you? Dealing, representing retirees, folks that are on Medicare. Can you provide a little bit of color and context as to, the issues and challenges that you were hearing from your constituents?
Sure. Most of our members and people of retirement age in general, the thing that hit them the most was isolation. It was not being able to connect with family, not being able to hug your grandkids, not even be able to see them. And it became very challenging. They weren't able to meet with their friends. They couldn't go places. And so a lot of our focus during this time has been to make sure you reach out, that you talk to someone, or that someone talks to you, or you have a friend list, give them a call. For people who are elderly, my members have a pension. So they were able to get through most of it on the financial side, but on the physical contact, the emotion side has been very draining and difficult and continues to be.
Jessica, what about you? I was, down in New York City a couple of weeks ago. I mean, I think it depends on who you talk to about what the future of New York looks like. It certainly felt like it was on the upswing, but talk to us a little bit about the challenges your members have faced.
Yeah, well, I just thank you so much for having me, and I'm so happy that Jennifer and Edward went first to talk about the human toll of this crisis, because I think sometimes representing the business community, sometimes it feels a little cold, but I can surely tell you that this was felt by real people. I think, during the crisis, you do have to break down the impact that was experienced between large companies and small businesses. The larger companies, there was still a huge disruption, but a lot of what they faced was, around around human resources, in terms of how do they move to working from home? How do they implement all the new mandates and laws that came about? And I think that they were able to absorb for the most part, some of the additional costs that came from this. But small businesses had a very different road. And the revenue losses have been so widespread. We've already seen a lot of businesses close in the city. During the COVID crisis, New York City lost 600,000 jobs. And the majority of that was because small businesses had to close or contract in some way. And again, the human toll, you have to understand that most small business owners have their life in their business, all of their life savings, but also their identity, in terms of that's why they started the business for the most part. So I think that there really has been a toll here. We have done everything we can to try to help businesses survive. And we actually have 7 staff members out on the ground going door to door to try to help small businesses get the resources that they need. Wow,
that's excellent. The work you all are doing for your members. Wendy, what about you? I mean, certainly, I think you've got a unique perspective, both, as far as, looking at it from, the public health impact, but also, certainly we recognize there are a number of challenges that the delivery system has faced throughout the pandemic and even going forward.
For sure. So I represent hospitals on Long Island and in the Hudson Valley. And so along with New York City, we took the earliest and hardest hit from COVID. And that's had a number of consequences, not least of which on the communities that my member hospitals serve. From the hospital perspective, and particularly for their workforce, I think of this as running a marathon with no known finish line. We don't know when this is going to end. So at the beginning, we had just, real financial devastation across the healthcare sector, as with so many private businesses, with elective procedures and other services being shut down. That's come back, but maintaining this high level of readiness has been really expensive. Having separate triage sites, keeping extra staff, making all of the operational changes that you need to make for handling a highly infectious disease. And we've never really been able to let our guard down because, as we've seen, waves peak and they valley, and we don't know necessarily when they're going to bounce back up again, which unfortunately it looks like we're seeing right now. For our workforce, that has been true as well. They're running that same marathon. It's just been an unbearable strain on the healthcare workforce. We have lost some staff due to the vaccine mandate, but we've also seen an awful lot of retirements because this has just been an incredibly stressful time. The good news, I think, is that the pandemic has also inspired a significant number of people to go into clinical and community health fields. I don't know if that's going to be enough, and we'll probably have a gap there in terms of the time it takes for education, but I'm at least a little bit hopeful on that front. With respect to the communities that my member hospitals serve, this has played out in a way that really exposed those disproportionate impacts for people in disadvantaged communities. Many of the social determinants of health, which I know you've spent a lot of time talking about in your conference, really complicated COVID. Economic status, having established relationships with primary care, having access to childcare and paid sick leave, all of those things complicated the course of this pandemic. And it's something I think all of us are going to struggle to rebound from for a long time.
So over the course of the pandemic, we've seen at both the state and federal levels, different financial and mitigation packages that have come out to try and offset some of the challenges that that different stakeholders and groups have faced. Are there approaches that policymakers should be considering, either at the state or federal levels, to mitigate further both the financial and health impact of the pandemic? And let me go back the other way this time, starting with you, Wendy.
Well, I think there are a lot of things that we would do differently if given the opportunity. From the hospital perspective, we do drills all the time. We plan for pandemics and other kinds of emergencies. We have not just drills within hospitals, but regionally, where we bring in all of the other players in the field. And we've gotten quite good at that, I can say with confidence, in both of the regions that I represent. Unfortunately, a lot of that got thrown out the window in this pandemic. Government reacted differently and wanted us to go in different direction than a lot of the plans that we traditionally had in place. And so that got us off to a slower start in some cases. I do think that we need to be acting like the next pandemic is right around the corner, because it might be. And so we have to think about what we would do differently. We really need investment in better public health data and surveillance systems. I think that was clear throughout the pandemic. From the hospital perspective, it forced us to spend a lot of time and resources on reporting. From the public health perspective, we just didn't always have the data that we needed. And I really think going forward that we need for policymakers to engage those sectors outside of healthcare, because we know now what the impacts can be. We need better preparations for things like childcare access and remote schooling, and supply chain disruptions certainly were a huge part of the story of the last 18 months. And if we don't really start to think more globally about the healthcare system to address elements like that, we could see the worst impacts of COVID repeated on our communities.
Jessica?
Yeah, I mean, it took a little while for the federal government to figure out meaningful solutions. It was a few months, if you recall, before they were able to pass a stimulus package. So that was painful. But when they finally did it, it did actually help a lot of businesses. Just in New York City, $31 billion in PPP loans were invested here. So that is a huge amount and probably saved many, many businesses. And of course, there were additional funding streams that also came out of Washington, which is fantastic. The biggest letdown, though, is that there were so many businesses that were not able to take advantage of these funding streams. And of course, it was usually minority entrepreneurs who had the most difficulty. The paperwork was hard. And I think some of the things that they were asking for, not everyone was able to produce. Some of the, I don't want to get too much into the weeds here, but you had to provide tax statements and show that you were profitable before COVID in a way that was difficult. And also there were some businesses that started right before COVID, opened their doors and were not able to take advantage of help because they were just weren't old enough. So I do think that the need for technical assistance and really helping people get their paperwork together, understand what the rules are here. We did a lot of that, but it wasn't something that was part of those programs. And so I think we really need to think about that. We need to be providing more technical assistance, more help to those businesses who need it the most. The other thing, and I don't want to harp on it, is that what we've seen, especially in the last few months, is government trying to push employers to be the face of enforcement, which I think we understand why that is. But for example, in New York City, right now, restaurants have to be the ones checking whether you are vaccinated or not before you can come in. And I think that's been controversial and harmful in some ways to some businesses. And I think we understand why that is the case. But of course, if we had more time to really think this through, I'm sure that there are other ways to go about some of this. So.
Yeah, and it certainly puts, not just your members, but, their employees in a difficult position, Jessica.
Absolutely.
Ed, what about you? I know, at one point we talked a little bit about the vaccine rollout, but, your perspectives.
Well, from a cost perspective, most of our members are on Medicare, which helped get them through all this. And regarding cost, the Part B premium just came out. It always goes up. Fortunately, there was a significant increase in Social Security. So that give and take every year is to how they're surviving and how they're doing. In regards to the vaccine, that was very difficult. We were the first group after healthcare workers and nursing home folks, when they opened up to the quote general population, and it was just horrible process. It was abysmal. Whoever at the State Department of Health came up with this was probably some tech person somewhere who had no concept of what it was like for seniors to try and navigate the system they developed. It was not user-friendly. It was less than user-friendly. It was unfriendly. And it was very frustrating for our members to try and get an appointment. It was a horrible process.
Jennifer, your thoughts as far as other policy approaches that either at the federal or state levels we ought to be considering to address some of the impacts as a result of the pandemic?
I have many ideas, and I'll share with you that, as one might expect, I'm centering a lot on low-income individuals and families. Throughout the pandemic, we heard repeatedly a lot of talk about the social determinants of health and why, that being the cause, the reason for the higher rates of infection and the higher rates of death among persons of color, and particularly Black and Latinx persons. I don't think we heard enough about the root causes of those social determinants of health. It was almost as though we stopped at the social determinants and said, yeah, it's lack of access to quality health care. Yes, it's environmental hazards, housing hazards, occupational hazards. And it was kind of like we left it there like, oh, we'll just fix the occupational hazards, or let's just improve access to quality health care. We didn't really go the next level. Like, what is the root cause of those issues? And the root cause is, centuries long inequities, in just, access to the basic goods and services that provide for well-being. And what I'm really speaking to is income and wealth generation. And if I just may go a little step further, in the connect between racism and capitalism. And so, if we really want to fix this, then we need to center on the root. It's not, communities of color have long been deprived of, environments that really center on quality healthcare, safe and affordable housing, economies within the communities themselves that keep dollars within the community. And so I would say that we need to be centering right now, in addition to what has been talked about, on the structural changes, not just policy, but the structural changes in what we believe and think people should earn in order to meet their basic needs, and not simply be reliant upon systems that maybe if you fall somewhere between 100 and 20% of poverty, you'll get a child care subsidy or you'll get a housing subsidy. But here in a state like New York, you can be at 300% of poverty, and the cost of living in the community in which you live far exceeds what you're actually making. So I think we need to be centering on that.
So moving on to sort of healthcare costs. Beyond COVID-19, for each of you, what's the number one healthcare issue for the constituencies that you serve? And Ed, I'll start with you.
Well, as I said, the vast majority of retirees are covered by Medicare, which is just an incredible system. And most doctors accept it, most providers accept it. It's easy for the retirees and other seniors to navigate. So we feel good in that regard. One thing that really scares us is the proposal that perhaps would take all of us, not just retirees, but all New York residents, into this proposed New York health plan, which would be administered by the state. Because we have insurance, because we have Medicare, we are very fearful of going into this brave new world, especially when public sector retirees are identified in the bill as perhaps losing benefits, having lesser benefits. It's in the bill. So it's scary. It's not a good idea. I referred earlier to the vaccine. If that's an example of what might be coming, it's incredibly scary.
Thanks, Ed. And I know we'll pick up a bit more on coverage expansion, single payer, the New York Health Act in a little while. Wendy, same question for you. I might be able to guess what might be, one of the top issues outside of COVID, but what is it that you're hearing from, sort of the top, healthcare concern from your members?
Today, it's workforce. As I said earlier, our workforce is terribly stressed. We not only need to backfill vacancies, but we need to build a pipeline that's going to prepare us for the challenges of the next generation of care, where we've got an aging population and more diverse communities that we need to do a better job of serving. And we've ignored, frankly, that sort of like the Medicare and Social Security trust funds running out of money, we've ignored that there are retirement cliffs coming among healthcare workers. And COVID has only exacerbated that challenge. But it's following very closely behind is always financial sustainability. The workforce has an impact here too. You know, if you've got traveling nurses coming from another state that are getting paid double or triple what the frontline nurses were getting paid locally because of the market dynamics of this crazy moment in time, it's going to be hard to push back on that. And we're going to have a lot of upward pressure on wages. That's only going to make the financing of the healthcare system more complicated. In particular, in the state of New York, we haven't seen our Medicaid rates increase in more than a decade. And we've been living under this global cap while an ever larger percentage of patients in the state are covered by Medicaid or Medicaid-like products. It's just not sustainable. And I think we saw it was abundantly clear over the course of the last year and a half that there are limitations even where we do have that broad coverage expansion.
Jennifer, number one healthcare issue you're hearing from your constituents?
Continues to be access to quality care. That's number one. And then we're hearing increasingly about mental health challenges, mental health concerns, COVID related and just exacerbated by COVID.
And then Jessica, from the business perspective?
Cost. Just personally, at the chamber, our health insurance went up 36% this year. That's really hard to, we're technically a small business. We have 12 employees. It's hard to absorb. And, you have to also then pass along some of that to the employees, which is very, very hard. And again, I'm not alone. I'm hearing this from a lot of our small business members, seeing these increases. It's just not sustainable. And it's also really poor timing because these businesses are trying to get their revenue up and going again. They're already in a precarious situation. So this has just been really, really tough.
So Jessica, as you talk to some of your members, particularly small businesses, are there approaches, strategies that either they're thinking about in terms of dealing with increased healthcare costs, and second, are there strategies or approaches they'd like to see the marketplace take to address some of this?
Well, again, one easy thing before I sort of jump into the mechanics of everything, I think one easy thing that we always need to be thinking of is small businesses have so little information and help available to them at any given time. Usually, a small business with fewer than 20 employees does not have an HR person. It's the business owner who has to figure all of this out. And so, it's very hard for them to understand where to go, not just to get health insurance, but how to look at the different options and really try to figure out the best and most affordable options. So even with the exchange, it continues to be very difficult for the average business owner to even know what to do or where to go. Beyond that, I think, businesses are looking for some sort of subsidy to help them be able, small businesses want to do everything they can for their employees. And it really does come down to what they can afford. It's not about being a mean employer. It's about what can you actually afford. And so anything that the government, and obviously the government has articulated at the city, state, and federal level that they want more people to be insured. And so I think for, realistically for a small business that can barely afford it, sometimes the business owner can't even afford health insurance for themselves, that we do need to look at ways for government to help subsidize this so that more people can be insured through small businesses.
So Jennifer, you had touched on sort of the conversations that have gone on around social determinants of health, and that that we haven't we've only sort of touched the surface. So from your perspective, what would be most impactful to your constituents, and are there policies, programs that should be put in place? Obviously, as part of the state's next 1115 waiver, investments in in addressing, social determinants of health, investments in housing and those other underlying factors are there, but, you're the one who's, on the ground dealing with this, day in and day out. I mean, give us a little bit of, color and context as to, if you had your druthers, what would be the things to really drill down and address those issues?
So if I had my druthers, I would begin with revisiting and then abolishing, or maybe better yet, updating, maybe that's more palatable, the federal poverty level, which is the standard, the guideline used across the nation to determine who technically is and is not poor. And it's the guideline that is used to determine who is eligible for basic income supports, including housing supports, healthcare supports, childcare supports, and more. The challenge with it is that it is deliberately discounted because the government uses it as a way to keep wages low and to keep the money that it puts out for income supports low. So just very quickly, a family of four anywhere in the United States that has an earned income of $26,500 or more, technically is not poor. And anybody listening to this, this panel discussion should be asking themselves in this moment, where in America can an individual, let alone a family of four, live on just $26,000, $26,500? But if you do that, then you get to suppress wages because a family of four, two working full-time, federal minimum wage, $7.25. Annualized, they're making $30,000. That appears to be more than what a family of four who is poor in America looks like. And so you get to suppress wages, and then you get to suppress the amount of money that you put into income supports. If we really examined and addressed what the true cost of living is, controlling for geographical circumstances, and looking at how people are working these days from county to county, and not just state to state, but county to county, then we would begin to really center on what it costs to live in America, what it costs to pay for basic health care, what it costs to pay for basic housing, all of these social determinants of health. And maybe we begin to create a different value base and way of engaging with low-income persons and create, more sustainable lives, economic lives for them. That's a thought. You asked.
No, and listen, that's sort of an out of the box, idea that we hadn't anticipated. So we're updating the federal poverty guidelines, and that certainly makes an awful lot of sense, particularly when so much is attached to that. For example,
Medicaid's attached to it.
Medicaid, the essential plan, premium tax credits, et cetera, all have attachments. And I think one of the things that as we'll get into the discussion about universal coverage and coverage expansion, but the ability to provide individuals with subsidies or tax credits certainly is helpful. And New York has gone a long way using the essential plan and additional federal funding coming in. But there's also a big group of folks who who make too much to qualify, but still struggle with their healthcare costs. So completely, that's an interesting idea that we hadn't considered. So sort of just picking up one last piece, thinking about healthcare costs, cost drivers. Our opening panel on Tuesday gave us some perspective of what the healthcare outlook beyond COVID-19 is going to be. Earlier today, we had a panel discussion on addressing healthcare cost drivers, and regardless of when the pandemic ends, many of the underlying factors that were there before, such as increased prices charged for pharmaceuticals, has not abated. And then you layer on top of it, other issues related to long-term COVID, ongoing testing, vaccinations, et cetera. Are there approaches either government or the marketplace should be undertaking to to keep healthcare affordable for employers and consumers. And let me just open that up to the group and see if anybody has any thoughts on that. So,
In some circles, you know, people are advocating for the New York Health Plan, believing that it would do a good deed for, especially for lower income persons. But, you know, there are also very critical concerns. And I happen to, be partnered for life with an individual who works in the insurance industry. And, you know, this person has shared with me, you know, some of the attendant concerns, like my father used to say all the time, good leaders control for the consequences they intend. Great leaders control for the consequences they intend and the ones they don't. And so, you know, I think that, and Edward, you know, again, speaking to maybe some of this, we need to look at what are some of the consequences of a New York health plan that we don't necessarily intend. And yeah, I mean, I do think it warrants consideration, but we need to look at the value add and what are the drawbacks.
So on that point, and we might as well, you know, jump in, you know, Wendy, let me start with you. You know, just from a hospital standpoint, what kind of impact does, would the New York Health Act or moving to a single payer government run system mean for, for the hospitals that you represent?
Well, based on all of the projections that we've seen around the legislation that's been introduced, it would be financially devastating. It's, as I said a few minutes ago, we've been living under a Medicaid global cap now for about a decade. And although it is not as rigorous a cap probably as it was intended to be, what has happened is you haven't seen reimbursements increase for a decade. Wages have gone up, costs have gone up. Certainly the costs of the last almost 2 years now in the pandemic have been extraordinary. And we don't really have a mechanism that accounts for that. Medicare reimbursements essentially are flat. So what does that mean for your members, Eric? That means that we have to shift more costs to commercial insurance. And that means for Jessica's members, they're paying higher premiums. It is unsustainable as it is. But I do think that we need to acknowledge that costs are going to continue going up in healthcare, because not only do we want the best healthcare, we have the most incredible healthcare system from a clinical perspective in the world. Everybody wants the newest technology. Everybody wants to have access to whatever services their physicians prescribe. We all want that, and we should demand that as consumers, but there is a cost attached to that. And those costs are only going to go up when we've got an aging population, right? We still have that. We've just started to see the crest of the baby boomer generation retiring. They are not by any means in their most expensive healthcare years yet. So we're not going to see healthcare costs less over time. I do think a really important component of it is cultural. You know, we have tried in recent years to handle reducing healthcare costs by reducing utilization or just changing payment models. And what does that do? It shifts risk. It doesn't really change anything about the cost structure at the end of the day. We need to make it so that people have great access to primary care in their communities. And we've got a culture that reinforces using that care and getting preventative care so that we don't just have people coming into the hospital, for inappropriate utilization, or worse, just coming in much too late. I think we've really struggled in this country to reckon with what healthcare costs, why it costs that, and what we all can be doing about it to try to lower costs. You can change the policy and change prices, and there'll be consequences of that, good and bad. But at the end of the day, are we really improving the quality and access of care to patients? I don't think that's been the primary focus here, and we got a lot more work to do.
Ed, I know you had touched on some of this a little bit earlier. Additional thoughts as to what a New York health plan, the New York Health Act would mean to your members.
Sure. Well, if people talk about single payer, Most senior citizens already have single payer. It's called Medicare, and it works. And this Health Act, especially as it relates to public sector retirees, as I mentioned earlier, contemplates us losing benefits. I mean, why would you put in statute that we contemplate taking away benefits? I testified at the hearing 2 years ago, I guess it was. And the statement was made, well, nobody's going to lose any benefits. And I said, well, if nobody's going to lose any benefits, that means everyone gets the level of benefits that the highest person gets, which I guessed at that point might be New York City teachers. I mean, that's the only way nobody's going to lose benefits. So for something that's been around so long, it doesn't strike me as an extremely well thought out plan. They want us to believe it's going to work. The initial foray of the Department of Health on the vaccine rollout was horrible. And we told them it was horrible, and it didn't work. They didn't care. They didn't listen. They didn't change it. Trying to get retirees to register online to go to some vaccine site, which didn't have appointments available, put in your information. The computer didn't save it. You had to re-register all the time. And it would say no appointments available. So we astutely said, well, if you want to book a flight and it's sold out, you go on standby. Can't you just take our information and let us know when the vaccine's available? They just rejected it. It was not well thought out. Seniors couldn't do it. They had their grandkids come over. People would go on at 2 in the morning or 3 in the morning to try and get an appointment 3 months out. And if this is an example of where we're going, we don't want any part of that. We want to be able to call our doctor and go and have an appointment. It's only 4% or so of the population that doesn't have insurance. For the most part, our members have insurance. It's Medicare. And then they have a supplemental plan, but we don't view this as necessarily something good.
Jessica, thoughts from your perspective?
Yeah, I mean, I think, long term, there are some things in this act that would be beneficial for small businesses. There's no question about that. But we have not supported it just because the cost of admission is just way too high. It would just be very devastating to the state budget. I think, ultimately, big change needs to happen at the federal level, and they need to get their act together. They can't seem to do anything these days. But the federal government is really the place where this needs to happen. Just to put it in perspective, I mentioned the PPP loans for small businesses earlier. That program, there was so much money that the federal government put into that program, it dwarfed the state budget and the New York City budget combined. I mean, that is the place where they have the money to play with this. They have the power to make really big changes. Because obviously, when you go to those economies of scale using the entire nation, that's where big change can happen. So unfortunately, we have not supported it.
So that gets us to the question of how do we get to closing the gap? I mean, the good news is New York's done a great job over the last decade, reducing the number of uninsured from about 10% to less than 5%. And in the midst of the pandemic, we've seen a further reduction in the number of uninsured, in large part because of the work that's going on between the federal government, state health plans, the delivery system, consumer groups, businesses, and others. But are there are there other approaches that we ought to be thinking about to reduce the gap in coverage? I know there's been a lot of conversation about sort of either opening up or expanding the state's essential plan to allow for undocumented individuals to participate. But are there other ideas that folks have been thinking about that we as marketplace participants ought to be considering?
I'll jump in here because I didn't get a chance to jump in on something Jennifer said before. In my association, we have been assisting consumers with health insurance enrollment for more than 20 years, going back to the start of the Family Health Plus and Child Health Plus programs. Something we're really proud of. We've helped something like 70,000 people get health insurance over the years. But we, because of where we're located in the state, we had a lot of people that really weren't eligible for assistance because of the federal poverty limit. Because it's a more expensive region, people have higher costs of living, that makes salaries a little bit higher, and that boxed people out of Medicaid. FPL is a statewide limit. Obviously, that 100% of the federal poverty limit on Long Island is a bit very different in terms of meaningful dollars than it is somewhere in the southern tier. The essential plan has been a boon, frankly, because there were so many people who had just a little bit too much income for Medicaid, but could not meaningfully afford insurance on their own. And so for the regions I represent, that's been really important for closing the gap. And when you look at the statewide data of who's enrolled in the essential plan, the vast majority of those folks are downstate for that reason. But it is something that we ought to look at in terms of having eligibility that reflects the regional differences in costs and wages. I think that would be an important exercise. Certainly undocumented are the single biggest group out there that we're still trying to get covered. But a lot of it is also just the churn of people as jobs change, as other benefits they're eligible for change. People go in and out of the system all year long, and we ought to have better mechanisms for continuity there too. I think that could knock a couple more percentage points off.
And that's an interesting point, Wendy, kind of picking up on sort of, regionality. And I think that, plays into some of the thoughts that Jessica had as far as, some of the challenges that, employers face. That might be an area where we want to give some thought. I think the challenge always becomes, where do we get the money? Where does the funding come from? But I think we could probably get creative with some of that stuff. So let me move on to one of the panels that we had on the opening day of our conference looked at the issue of tech post the pandemic. I'm curious to hear folks' perspective. Ed, we certainly heard your perspective on the technology challenges that came with the rollout around the vaccines, but certainly, telehealth was an area where we saw a big increase in usage, particularly at the peak of the pandemic. Let me open it up to the group, and maybe Wendy, let me start with you about sort of the role of telehealth, and then are there other technologies that folks have been giving some thought to that could either lower cost, improve quality, or address some of the inequities that we've been talking about in the healthcare system?
Yeah, certainly telehealth has been, it's like the COVID is the thing that we've been waiting for to push telehealth forward. The piece of this technology has certainly been in place for a long time. And I don't think we're putting that ketchup back in the bottle. There has to be a payment model that makes sense for providers to continue doing that work, and something that supports the infrastructure. Other technology, I mentioned this before, we desperately need to have modern public health data and surveillance systems, because it was just, for the reasons Ed expressed, which it's preposterous, really, that we didn't have a system to register people for appointments, but just in terms of tracking and tracing the disease and understanding, how the variants were moving across the state. We really need better support there. But on the flip side, when I think about the vaccine program, what worked the most was old-fashioned boots on the ground, getting out into communities with trusted providers and trusted community leaders, and showing up on people's doorsteps practically. It was really, in politics, you'd refer to it as retail politics. Retail healthcare has a different connotation, but, that sort of old fashioned kind of hard work proved to be very effective when we rolled out the vaccine program.
Thoughts from others?
That's great. I love that, Wendy. And I think that's sort of what we've been doing, right? By going door to door, it really has been to try to help, again, these businesses understand that their PPP loan is out there, what other resources. We've been helping businesses who didn't have an online presence get a website. I mean, whatever they need to survive. And this is a public-private partnership. This was private funding through a grant from the Peterson Foundation, actually. And, I think that the lesson here is government doesn't have to do this all on their own. They don't have to fund all of these programs on their own. We need to be doing more of that, more public-private partnerships to really be getting the word out about help that's available on all levels.
Could I just make an observation that, going to try and get the registration for the vaccine and how difficult it was, we have members that don't have computers. And, it's a lessening portion of the population, but they're out there. They're still out there. When I go to the doctor, this is for all you providers out there. When I go to the doctor, I get an email, I say, go to your portal, and then I have a different doctor that go to different portals. The doctor I go to is in some other health plan, and I don't recognize the name. I mean, just from a consumer point of view, more on the elderly side for the most part. I know it's the way to go. I know how efficient it is, but it's very confusing and difficult. And, it's a change that's coming. Technology is coming and it's here and it's going to improve and get better. But there is a segment of the population that really can't deal with it. They're just not equipped, both intellectually and computer-wise, to navigate.
Yeah, if I can expound upon that, one of the things, one of the criticisms we heard about the system, the technology in connection with vaccine appointment scheduling, was that in a lot of lower income communities, people don't have broadband access. So, even if they had the technology in terms of the hardware, by the time, if a site opened up, by the time they got on, all of the spots had already been taken, by people who have, high-speed access, high-speed internet. And so even as we, I think as we build out this technology, I really appreciate what, Ed is saying about the elderly community. But we also have to think about what are the impacts, like when you're doing this, it's value add, but for whom?
And that's a great point, Jennifer. And Ed also, one of the comments that came up during the course of our turning to tech post-pandemic was, for as much focus as we gave to telehealth, I think it was April Coe, who's the CEO and co-founder of Spring Health, which is a online mental health service provider. You made the point that telehealth shouldn't exacerbate those inequities. So, whether it's individuals who may not be tech savvy, or to your point, that Ed was making, or Jennifer, to your point, about access to broadband and the technologies, we need to sort of figure out a way to make it accessible. So that's going to get me to my final question, and it's really touching upon the title of the conference, ensuring access to advance. How do we ensure that innovation is accessible to all? And I'm going to sort of grant each of you like temporary superpowers here, either king, queen, emperor, however you want to designate yourself, but really ask the question of, with advances in technology, medical treatments, we're doing so much more than we had even thought we could do pre-pandemic. How should different stakeholders, government, payers, and providers be thinking about how do we make sure that innovation is accessible and available to all individuals? And so I'll start, maybe I'll sort of go down the line. I'll start, Jessica, with you, and we'll work our way down.
Yeah, I've mentioned it earlier, but I think just to sort of bring it home, I think it is all about technical assistance for small businesses in particular. There's so much out there right now, but many don't know about it. And so that's really what we need. We need more. And again, it could be a public-private partnership. I just want to stress that we're not expecting government to do it all alone.
I mean, that's a great point, Jessica, sort of going back to, everything that happened with COVID and testing and outreach and enrollment. And I think certainly after this, there's probably worth a conversation of, is there a way that, if resources are finite, how do we sort of reallocate and redirect necessary resources? Jennifer?
I appreciate the point that Jessica made, and I would just add to it, build on that when we are, engaged in the work of innovation, we need to be thinking about the communities we're trying to reach and making sure that the models of innovation are responsive to those communities. Very often when we engage in innovation in any space, oh, this is a great idea, let's do it. And we don't do a thorough assessment and analysis of, okay, and so great for who? Or how do we make it great for everybody? And so I suggest that that's just a component that we build into, the work, the build out. How can this meet the needs of all the people we're trying to reach to improve healthcare?
Wendy?
That's a great point, Jennifer. I think that there are so many sort of post-mortem investigations we ought to do on COVID. And I hear you, Ed, on all of the challenges of getting your members signed up for vaccine appointments. I have plenty of scars from that effort too. But I actually think of the vaccine rollout, once we got past those initial issues, as a pretty good test case to think about how we can do a better job of mobilizing our health system around health equity goals. We had perhaps the largest and most comprehensive public health effort that really had health equity as a main goal. It's certainly that I can think of in any time in recent years. Healthcare providers wanted to participate because getting people vaccinated was the only way we could relieve stress on the system. Businesses and CBOs wanted to get involved because they wanted their work to get back to normal. And the government was footing the bill. So patients' ability to pay wasn't a factor here. So it's really a very different thing than we've ever done in healthcare before. And I think we should really think about, what that exposed and what we learned from it. I think what it exposed is that we don't have the public health infrastructure we need, that the ability to pay or not having to pay does make a very big difference in whether people pursue care, that we've got some real communications challenges out there in the communities, and that created an environment where a lot of, less credible communication could flourish. And we learned that those relationships at the local level are really, really critical, that you have to put the boots on the ground. You've got to go to the people you want to help. You just can't count on all of our normal channels that we utilize fixing a problem that we haven't been able to fix using those channels currently. I think we, broad-based, not just in the healthcare industry, but across communities, need to do that kind of assessment.
Ed, bring us home.
Sure. I think the pandemic showed an incredible failure of innovation. People were forced into this process that was created. Everybody's going to get their computer. You're going to log on. You can't log on. I mean, it was a failure. And it's just not the way to go. And Wendy said, and it only started coming around when people said, all right, why don't we go into the community? Why don't we let county health departments participate? They're ready. Why don't we use them? That's not innovation. That's just using what's currently available. And we didn't do it. And we didn't do it on purpose. And so I think this idea of the whole innovation process was a big failure. And it wasn't until we got around to saying, gee, let's use some logical approach. Why don't we go to where the people are? Why don't we give them shots there? So I think the whole system, well, we've never been through this before, but it revealed a lot of things that need to be worked on.
I think a theme from all of this is, we need to meet, people, we need to meet individuals where they are. So look, Superpowers rescinded, but with that, I do want to thank all of you for being part of today's panel discussion. I mean, this, like I said at the outset, this is always my favorite conversation. It gives everybody an opportunity to just sort of, offer their their perspectives and the concerns that their the constituencies that you all represent have, and it's always good for our industry to hear from all of you. So thank you all again for being part of this. We really appreciate the the time that you've taken out of your busy schedules today. Before we wrap up this year's conference, I do want to announce the top point earners of our gaming challenge. Our third place point earner is Siobhan Hewitt from Liberty Dental, who will receive a $50 Amex gift card. Elizabeth Booty is our second place earner. From MVP Healthcare, she'll receive a $100 Amex gift card. And AJ Wright from Highmark, Western and Northeastern New York is our top point earner, who will receive a $250 Amex gift card. Before we let you go, I do want to take one last time to thank all of the panels over the course of these 3 days. These have been thought-provoking, informative conversations. I also want to take a moment to thank the terrific HPA staff for their work, not just in getting this program together, but again, for the work that they do every day representing our industry. And then finally, I'd just like to thank our board, our sponsors, our exhibitors, and all of you who've tuned in over the course of the last 3 days. Without you and your support, this would not have been possible. We will be sending out an email after today with a link to an evaluation form. We really encourage you to take a couple of moments to fill it out. These help us evaluate this, not just this year's program, but to give some thought as to the programs that we're going to be putting together for next year's annual conference, for our programs throughout next year. With that, thank you all again. I hope everybody stays safe and healthy. If you haven't already, get your booster shot. I'm getting mine this afternoon. With that, have a great Thanksgiving, and we'll talk to you all very soon. Thanks, everybody.
Thank you.
Thank you.